Alrighty, what's going on, guys? How's everybody doing? Welcome to AI Live.
Welcome to AI Live. It's like this is our first. But we're getting going here. But this is our first AI Live, and we had such a wonderful response to some more time with Gideon and Lori that we want to make it. Keep the fun alive. Keep it casual. We want to keep the education going, keeping you really well informed on what's going on. So here we are again in a fun setting.
I know. What have you been up to?
It's been crazy,
right?
Oh my gosh, I've been bombarded. Had to open extra days to take care of.
Extra.
I am working extra. Thank you very much, partner. but it's been you've had to work extra days.
I have. I added extra days. Well, it's not like we have anywhere to go. I mean, seriously, no food. I know some people follow me for my food and stuff like that, but there's nowhere to really go. Yeah. So we'll see how all of this comes out, but we decided to play around with this AI Live concept, and hopefully you guys enjoy it and keep following us. We're going to be doing this hopefully on a monthly basis, so check us out and hopefully keep following, and we'll see where all of this comes out, and hopefully you guys get more interactive. We're going to try and make it like a talk show, right?
We want this to be interactive. We want this to be something that you guys can talk to us. You guys can send questions in for us. So we don't want to just talk to you. Later on we're gonna have questions. So if we talk, we're gonna be talking about kind of interesting subjects today, rheology and fillers and such. But we want you guys to ask us questions. So this can be interactive, and you can get a lot out of this. Yeah. So it's something that we really want.
It's hard, and we both of us do a lot of trainings out there, and you go to ones that are larger clinics, and you have peers and you have other people in there that you can bounce ideas off of, but then there are those of you that are probably just in a small little clinic, and you yourself are the ones working by yourself, and it sometimes gets scary. I remember when I first got started, I was the only one-ish there at one of the clinics, and you're just like, I think we'll just try this out, and kind of have to get a little ballsy sometimes. And so hopefully this will open up a new interactive forum. We have a lot of things planned for AI in the future. Hopefully we'll be launching a couple of new things, hopefully towards the end of the summer. It's taken a lot of time and effort, but we're excited for this, and hopefully we'll create a whole educational platform that really, really allows you guys to maybe communicate with each other, communicate with us, and just have that per se, that bouncing board, or somebody to be kind of a mentor, maybe digitally, virtually, that you can respond to and get a hold of us in some sort of way.
This kind of reminds me of like being a parent. You always want, what you don't get when you were a kid, you always want to give to your kids. So when we were going through aesthetics, 13 years ago, we didn't have something like this to support us. We didn't know about aspirating. We didn't know certain things you couldn't dissolve. There's a lot of things that we didn't know, and we didn't know so much about anatomy. Right. We weren't really taught a lot of that stuff. No. So now, being the parents, we want to share it with everybody else, so that you really, really you really learn from the safe way, and you learn anatomically, and you learn everything. And that's why we called this the Aesthetic Immersion in AI Live. The Aesthetic Immersion Live is we want you guys to learn everything. And we have a vision.
Yep. Our vision. What is our vision?
We do.
I think it's really about creating a platform. I think you and I have talked about it, going out there. I think other countries are lucky because when they get their approvals for a lot of the fillers and toxins, they get full approval for all the whole face. And when we go out and train for some of the companies, we're restricted, and we're like little golden handcuffs. Like, people start asking about all these other areas that the basic areas that people know is basic. And yes, you can teach more and you can learn the artistry of certain areas, but then you start talking about off-label areas like temples and under eyes and chins and jawlines and all these other areas that really, really, you really don't get a hands-on experience. Right. So we wanted to create a digital aspect of it, but then also create a live aspect of it where we can get interactive with you. on the aspect of it, right?
Yeah, and I think what's kind of cool about AI Live that you'll find with this little show that we're doing is we want to keep it casual. We are going to talk about different subjects. We're going to have different guests here each month. So it's going to be at the first Tuesday of every month, 6 p.m. California time.
You want to be a guest? Reach out.
Reach out if you want to be a guest, if you have really kind of cool stuff to share with people.
Yep.
So we're going to have people that are heads of companies, people that are victims of problems with fillers. We're going to have some plastic surgeons on, things that will help you learn and grow from different aspects of aesthetics all the way around. People who put on aesthetic big conferences. What goes into that?
If you want to be a trainer, you want to be a speaker.
Want to be a speaker.
I didn't know how to do it. So, a lot of people have different visions for themselves in this field, and they have this idea of where they want to go. And so hopefully we can build a pathway for you guys and give you ideas, because we're still learning. I would admit, I still don't know everything about this field. And, even the legal aspects of this field, especially in California, it's mind-blowing the things you need to know with all these good faith exams and all these process and protocols. If you don't have them in your office, do you know that you can get into some serious trouble out there? So I think this is our way of trying to help all of you guys educate. So AI Live is to really bring out all of these topics that we need to talk about, because as a physician in school and in training, you really don't get any business side of things. And so, hopefully we'll build a whole component on the business side of a medical spa, just for business owners, for people who own med spas, but even you as employees who work with med spas. Like, what are your kind of rights, or what do you need your med spa to make sure that they're doing properly to protect your licenses, because you guys work hard for it. So there's a lot of things that I didn't know, and a lot of things that Lori's taught me, and a lot of things we've learned as we've really, really started delving into it. And so I think that there's a whole field of everything in aesthetic medicine that we need to delve into for all of you guys.
Yeah, that might be a subject for another show, is a lot of the really interesting policies and procedures that you think you're A-okay doing things, and then you learn what sometimes the boards have, or in the particular states, the laws that are hidden way, way down deep that we can't find, that you were held accountable for. So we'll probably do a show. I think that'd be awesome to do something really on kind of policies and procedures, so that, people think that a good faith exam is good enough for an order. I just talked to somebody last week that thought that, and I'm like, nope, that's not an order. You can't do anything with, even if you have a good faith exam, at least in the state of California. So there's a lot of good, interesting stuff. So we'll have a lot of interesting subjects, and it's just to help you be better at your specialty. We want everyone to be as safe as possible, as knowledgeable as possible in this specialty, because it's going to help us all be better. And we want you really to know that your only competition needs to be yourself. You don't need anybody else to be your competition. We've only touched 5% of the market. So your only competition is yourself. And if your competition is yourself, nobody's going to fault you for that.
Yeah, it really is. The goal is, for us education-wise, is we want to bring the whole industry up. I think if patients out there get bad experiences the first time they ever do anything, it will make that patient speak unkindly about our field to everybody they know. And so, how many oftentimes have you seen a patient that I've gotten patients where I'm like, okay, I want to do this on you. Oh, no. I had a bad experience the first time I ever did that. So I'm never going to do that again. I'm like, and you're like, you really need it. And, the goal is to hopefully we're all going to have mistakes. They're all going to learn from our mistakes and grow from it. Hopefully it really will elevate that so you make less mistakes. All the mistakes that we've made, hopefully you can bypass that
and dissolve all that stuff,
or dissolve it all.
So we started to talk about we've been really busy since coming back from COVID. We opened our clinic. I opened mine on May 18th, and it's been super, super busy. So what have you done the most of? What have you found that's been a popular item as we've come back from quarantine?
You know what? I've been doing a lot of fillers. Of course, your normal toxins. Everybody needs their toxins. They're all wrinkly.
Everybody came back. But here's the deal. we came back in May or so. May and June, everybody's doing toxins. So now in 3 to 4 months, everybody's going to be doing them again. So now we got everybody on the same rhythm.
Finally.
So we're going to have all every 3 or 4 months, everybody's going to be doing nothing but toxins. It's like, we're going to have a rush of toxins.
We'll see.
So order up, you guys. In three months, you're going to need it.
But no, I think a lot of fillers. Definitely.
Any filler more than others? Anything more than others?
I mean, I still love my Restylane lifts, like basic stuff, but definitely the new Restylane Kiss. Been doing a ton of them and really liking them. Really finding that it really plays very, very well in the tissue, and it looks really, really pretty. So definitely liking that and liking to see where that will take us. With all of these, it's a newly approved FDA one here in the US, so it always takes time to really see where the complete results are, as always. But from what I've seen and the patients who've gotten it done and followed up with me, they all love it. They probably all want more, but that's the generation that we live in.
I agree. I was doing a lot of refining lips before, and then I have been dissolving a lot of lips before they've been. I've been wanting to put filler in because I've seen a lot of migration with whatever. So, but that's one big thing. So I was asking you, that's one big thing is lips have been crazy popular, and maybe it's because everybody's got a mask on, they can hide it. But it's been crazy popular. I mean, like every day we're doing quite a few lips, so it's been fillers along with the fillers. Lips have been crazy off the chart popular.
Threads have been super popular for me.
Everything.
Noses and cat eyes have been really, really popular. But I think that's because everybody's been spending all their time on Instagram during COVID, trying to figure out how they can continue to improve themselves.
Nobody's gone out to dinner and everybody's paid off their charge cards. I swear, everybody's coming in like, my charge cards are paid off. I haven't gone out to dinner. It's like nobody realized how much money they save.
It really, really is. I think we're supposed to go to announcements quickly before we jump into our topics. Okay. So let's see, upcoming things that we have here at the Aesthetic Immersion. So July 18th, I've been doing a lot of webinars on Threads over the last couple of months. And so it's been, Threads have really, really been a fun, passionate thing for me. And so I really, really have enjoyed Threads. And so I decided that since these newer threads came out for the nose, and really I think the whole cat eye, the Bella Hadid eye and stuff like that really, really has kind of taken over as a trendy thing. I really think that you can modify it. So don't take that as just you're always lifting them. It really is for my younger patients who want a little bit more of the drama, to my older patients who have the saggy skin that really want a little bit of a natural lift. I think it works on all aspects of it and does really, really well. So I decided to put out there a July 18th course. So if you guys are interested, we're going to spend the first half of the day, and you don't have to come to both of them. We kind of split into two specialty aspects of it. The first half, we're going to be working on not fillers. So we're going to be working on nose threads. So I know a lot of us have been talking, and we talk about nose fillers as being very unsafe. This is a great one to work on patients' noses to really kind of create contour, create lifting without needing to do fillers. So a lot less, way less side effects, much safer because you're not going to run into that potential of blindness. So we're going to do the first half of the day based off of nose threads. Then the second half of the day, for those that want to join on that aspect of it, we're going to do cat eyes. And we're going to really teach you on how to actually just more lift the brow area, whether it's lateral canthal or just the lateral brow area. That's up to you and your artistry for your patients. But that's going to be that day. So I think we only have a few more. I think only like 2 or 3 more spots for each of those courses. So if you are interested, reach out. learn@theaestheticimmersion.com. Reach out to us so that you can get one of your spots. Otherwise they will go. The thread classes get booked up really quickly. And it's the hard thing I think people don't understand is just watching it online. As much as we can watch fillers and get that done, really when I get these threads, and I play with them, it takes me a while to play with them to really understand what they can do, how they work. I think that learning curve on threads is really, really much higher than even fillers. So if you are considering doing threads, remember that it does take even more hands-on experience to really, really get good at it. It's taken me about 4 or 5 years of research and play to really, really consider myself okay at it. I think the Koreans do much better work than we do here in the US. So I'm excited to learn from them in the future. But for now, if you are interested, we're having it's a small class. So I really limited down to a few students. So if you are interested, reach out.
Yeah, I think there's only a couple spots left. So, and one thing here with the aesthetic immersion, when you come to hands-on courses here, we really want one-on-one time with you. Yeah. So just so you know, it's not a cattle call. It's not one instructor to 40 students. It's one-on-one. And for a hands-on, you have us for an hour to an hour and a half, one-on-one with us. Yep. We want that immersive education.
We do, and we record it so that you get your own recordings, and so that you really can go back and really, really delve into what you were doing. I think a lot of times when we're teaching, you see students there just doing it, and you tell them to adjust it, and they just adjust it, and they're really not thinking the process through of what they're really doing and how to actually look at the whole thing. We get the luxury of standing back and looking at the whole picture and adjusting them accordingly. But when you're in there and you're nervous, you literally hear one thing and you do it, and then it goes out the other ear. So we intentionally do these courses in-house in our kind of studio, as you can kind of see, and we set it up that we actually record it for you guys so that you guys can go home and really rehash and revisit all the things that you learned that day.
Which is priceless, and that's our vision.
Yep.
That's our vision.
That's part of what we want to do. We want to create intimate settings so that you really get the best learning. Hopefully you're able to take the courses and literally that next day really start to treat your patients.
That's what I want. Also, coming up July 20th, I have a master lip course with AmSpa. So if you want to be a part of that, you have to go and sign up on the AmSpa website, which I don't know what their website is right now, but it's AmSpa. But it's going to be a 2-hour webinar, and it's going to be the master lips. So I'm going to have where I'm going to do a lot of lecturing on lips, kind of let you know anatomy, all of that stuff that has to do with everything about lips. And then I'm going to be injecting some lips. I'm going to be dissolving some lips. So I'll be doing everything in that. So that's on AmSpa. That one does cost something. If you're an AmSpa member, there is a discount. So go on to AmSpa and you can sign up for that. That's going to be July 20th from 10 to 12 p.m. Pacific time.
Perfect.
And then August 4th, our next AI Live, which is the first Tuesday of the month, we are going to be having the Aesthetic Show guests, Mindy Malat and Aaron Valera. Both of them run the Aesthetic Show and some of these big conferences. So what's going to be kind of cool is we're going to be talking about how to be a speaker at the show. If you want to help teach people, how can you be a speaker at the show? What does it entail? How do you submit your work for an award? Some of these awards are kind of cool, and what kind of cool things are going to be at the show. So we'll be talking next month about the Aesthetic Show, which is going to be kind of cool.
I'm excited
to go. The workings of it.
I'm excited to go.
Me too. I love going.
It's a great little conference.
I've gone for
it's in Vegas too.
Since 2012, I've gone to the Aesthetic Show, and it's grown so much. And when people ask me, if there's one conference you recommend I go to, first one I think of is the Aesthetic Show. There's so many conferences out there, but the Aesthetic Show is one of those that I always say there's so many different breakout sessions. Right. You can look at the schedule and go, well, okay, I want to be in this room at 2 and this room at 2:30, and I want to see this at 3 and this at 3:30. So you can go from room to room to room, and you can pick out the exact subjects that you want to learn on. Yep. So you're not pinholed into one day of listening to things that you might not want to listen to, but your days get busy there. Yeah. And it's a big conference, so there's a lot to go at that conference. Yeah. Yep.
All righty. And we'll be at the show too.
Yeah, we're going to be having a booth. The Aesthetic Immersion, our school will be having a booth at the show for the first year. So that's our introductory year there at the show. So it'll be fun.
And then August 29th, we are doing our Foundations of Advanced Aesthetics course. We decided to make a hybrid course. So this whole COVID thing changed our thinking. We used to have a very limited amount of students. This is for students who have not gotten into the aesthetic field and want to learn about the aesthetic field. This is for you guys who have been in the aesthetic field for maybe 1 to 2 years and really want a broader, more in-depth talk about truly the foundations of aesthetics. We get into toxins, we get into rheology, we get into a lot of different things with fillers and toxins. And so it is a intensive course. Normally we were doing it where you had 8 hours here doing lectures. And then you would come back the next day and we would do a hands-on course where you could inject your patients. A lot of our students love the course. What they found is some of the feedback that we got is the first day of 8 hours of lecture literally slapped them in the face so many times. They couldn't absorb everything.
They're like, I'm not doing aesthetics anymore.
So we decided while we were on COVID that Lori and I actually recorded the whole 8 hours of lecturing and we made them into modules. And so we actually have it as a virtual thing so that you can actually, when you sign up, you'll be able to do all the modules at home at your own time, at your own pace, and really absorb the information. Because there's a lot of information that we've gathered over the last 15 years of our own careers that we're handing to you guys and teaching you guys. So it really is a passion of ours to really teach on that aspect of it and really to get you guys the best knowledge and education that's out there at this current time. And we'll keep updating it as we need be. But we are offering our Foundations of Advanced Aesthetics. And so we actually have 3 kind of tracks. One is just you get the virtual didactic portion of it that you can do at home through the digital aspect of it. And then you can sign up for our hands-on course with us here that you'll get our one-on-one attention with injecting your patient and your model. Number 2 is virtual didactics, and you can come in on one of the days that we're doing hands-on courses and you can just observe. Those are typically going to be for people who don't have licenses in this state, but we're working on that. Hopefully.
And when you observe, you can interact with us and ask questions and listen to everything we're saying. It's pretty cool.
Yep. So, and you'll get the video so you can observe and watch and you get the experiences just like the ones that are actually injecting. So it's a really great opportunity. The other and last one that we've created now is a virtual hands-on course included with the virtual didactic. So we'll live stream what we're doing that day and you can join through the online aspect of it for those that can't make it all the way out here. So
the course, when you do the Foundations of Advanced Aesthetics course, this is not a foundational course. This is something that's you can take it if you're foundational, if you're new, but there's a lot of information in this course. There's a lot of information in this course. So we go through anatomy, rheology, we go through products, we go through facial aging, we go through everything in this course. It's a long course. After every module, there's a test. You need to take the test after each module. Once we know that you've watched them all, you take the test, then we allow you to come and do hands-on here in Southern California.
Yep.
So that's the only time you get to come and do it with us here. So that's a prerequisite to that hands-on here.
Exactly.
But it's awesome. So you can sign up for that. The virtual with the virtual observation, again, is just kind of you're being a fly on the wall and you can't ask questions, but you can sit in your home and watch it. And that's the price of that is $9.99 for that big long course, which is pretty good.
Yep.
But the observation course here and the hands-on here, those courses are a little bit more.
Yep. Perfect. I mean, so if you are interested, that will be August 29th will be our hands-on course here. So you can join, and when you do it, that virtual didactic portion, you'll be able to review that, I think, right when you sign up, and you'll have access to that for a couple months after that so that you can continue reviewing it and digesting all the information that's in there. So That is that. I think we only have 2 more. We do have a free safety series, so sign up for the free safety series that is out there. It's like our little snippets of 1 to 2 minutes where we're talking about safety things. So if you haven't
free,
joined,
so
sign up and join for free. And then lastly, we have our
buy one get one,
our BOGO for July. So to the end of the month, all of our webinars that have been recorded where we've talked about lips or under eyes or temples, differences in facial aging between males and females, a lot of different things that we have pre-recorded. If you buy one webinar, you'll get to choose one for free. So we've done noses and chins and jaw lines and lips. So there's a lot of information, a lot of pre-recorded webinars that hopefully if you are available to purchase it, it's buy one and get one free. And that goes to the end of July.
Yay.
Alrighty, so we are going to jump right into today's topic.
Yay.
So we decided to talk about just product rheologies, what we like, what areas we like to use these on, and we brought in a couple of pictures of just befores and afters of celebrities and talking about what they've done, maybe what they could do, maybe.
Yeah.
So we'll make this like
what they shouldn't have done, maybe.
So we're going to jump right into it right now. So let's go our little disclaimer. But first off, we have Mr. Tom Cruise.
I had to pick him.
She had to, definitely had to.
I had Tom, if you're out there. I had to pick Tom. And if we look at Tom through the years, we have 2001, 10, 14, and 18. Is this somebody who's aged really well? He's aged really well. And oftentimes when I'm talking about doing fillers well, doing the kind of helping somebody look refreshed and look more youthful, I think of Tom Cruise. There is a point where he did get a little bit have too much filler and got a little bit too full.
Fat.
Or fat.
I doubt that.
but when we're looking at something like this, if you look at a man, generally a man looks better with the sharper angles.
Yes.
And we have to be really careful about overfilling a guy because when we fluff them up like a female, it'll feminize them and they're going to look less masculine and less sexy. Right. So I think either he gained a little weight or
you can definitely see there's a lot more fat into this area. His 2001 picture, that light and dark balance. So remember, science of injecting and what the medications and what we're using mixed with artistry. So I always like to nowadays refer to artistry kind of like makeup artists. If you really watch the makeup artists, what they're doing is they're using that light dark balance on the face. So you can kind of see right in here between this 2001 and 2018 picture, he has a lot of light reflex into this middle of the face. And then he creates this shadow underneath there that has this more model-esque look, that concavity that really looks good. It really, really does look good. And on females and males, it looks really good when they're young because they have this nice full fatness all over their face. As they get older, you can see he's starting to droop down, starting to lose a little bit of volume in certain areas. To me, a little in the temple, a little preauricularly, a little bit more mid-face. And so this starts to drop down into this area. Here, I think he's probably gotten a little bit of fillers, and you can see that this is a little bit more rounder, a little bit fuller than it was right in here. And I think it could have been injected maybe a little bit more mid-cheek, higher mid-cheek area.
Everything's very low.
Everything kind of low because when you can see he's smiling, this is falling down. Typically when I train, I tell people, when you're looking at this nasolabial fold, kind of if you dictate or delineate the first third, the middle third, and the lower third, or the nasolabial fold down the marionette, this typical portion, if you draw a perpendicular line up from it, typically tells you kind of where they're missing a little bit of volume. And that's kind of where I would have injected him, starting even in here, because you can see that light reflex right in here. It looks really, really youthful in that picture. He could have used a tiny little bit into this area, more up higher in that sense, versus down a little bit lower, which I think he probably got a little bit. This probably started to sag a little bit more.
So we maybe filled it a little bit to make up for the skin sagging.
Possibly, maybe. Definitely.
Yeah.
Definitely.
And that's one thing I always often tell people is keep skin laxity and volume loss separate. Keep them on separate shelves.
For sure.
Because you don't want to overcompensate by doing filler for skin laxity.
Right.
Then you're going to end up having Cabbage Patch dolls.
I know a lot of the trainings in the past we've said, okay, well, you see this fold and this hanging down here. Let's keep filling, filling. And you get these people who are really way overfilled, middle lateral type of area. Remember, this is the mobile area. Codafana talks about that line of ligaments that comes down. Everything in front of that is a mobile area. If you actually hold your finger right on that line of ligaments, you go like this and make movements of it. You can feel all the movements in this front area versus all back in here behind the line of ligaments is the fixed area. So remember, when you're aging, you're globally aging. And so that global aging from the bone and the fat and all of that decreasing, this fixed area literally has nothing holding it because it's fixed. There's no mobility to it. So guess what it does? It falls forward. And so you have to realize when you're injecting what you're trying to achieve. You really try not I try not to inject too much in this mobile area. And if you are, it is going to be deeper, because the more mobile you are and you don't want to inject on top of the muscle, you're going to potentially cause that movement of product if you inject above the muscle in this area.
Right. And that's why knowing facial aging is so important, and knowing the aging process. Where do we lose the fat? Is it deep fat or superficial fat? There's both. And you got the SMAS in between. So you've got layers of fat. So we need to know as injectors, where did they lose it? Because that's where I need to replace it.
Right.
If they've lost deeper fat, replace deeper fat. If they've lost a little bit of superficial frosting, replace it, but very minimally. A lot of times when they lose it laterally, like Gideon, like Dr. Kwok said, everything falls forward. So you've got all this forward tosi. And that's not because the nasolabials, I always say, are a symptom.
Right.
The cause is loss of volume out here.
Are a symptom
all
of
this stuff
falling forward.
Exactly. That's where threads and facelifts.
I mean,
anything to get the skin back. And
it really is. I mean, I think that's where people don't understand threads just yet. I think it's still too new. The concept is still I think it's almost too new for people to really understand why threads work hand in hand with fillers. And my explanation kind of is, if you look at facelifts and how they worked with facelifts literally all they do is pull skin back. They pull skin back, they cut the excess in, and they sew it back up together. Now in the 80s, when they started doing those, you've got these people who are windblown because they pulled them so tight, but then they pulled them around this whole lack of volume. Remember, I guess anatomically, when you basically break it down, you have bone, you have a deep fat layer, you have a muscle layer, you have a superficial fat layer, and you have skin. So it literally is mirror images, and the middle layer is your muscle. So you as an injector need to decide, what is it that's missing? Is it deep fat and bone, so you need to use a structural or a higher G prime type of a product to replace that volume? Or am I going to be injecting on top of the muscle to create more contour, and I'm using really a light G prime, more flexible type of a product that integrates more, that isn't going to bunch up when the muscle is moving? Now, take into a fact that if I'm doing fillers, what I'm trying to do is create structure. Typically in my hands, I really go focus on bone. And then what I do is I take the threads and I'm placing the thread in that superficial fat pad layer above the muscle. And what I'm doing is the threads pull that fat that has started to descend and pulls that fat back up to the position that it used to be. So now that contour has been created by pulling them back up. But I've still done structural lifting with fillers.
And I think what you should be hearing is there's two issues we have going on. We've got skin laxity and volume loss. So if you do fillers, you got to do so many fillers to make up for the for the skin laxity that
Right.
you're going to overfill them.
Yep.
If you only do a facelift, then you're not going to replace the volume and they're going to look windswept.
Yep.
The soft roundness is what we need, especially on females. The
Yes.
soft roundness. So if you just pull skin up, you've lost that youthful softness.
Yep.
So if you can do a little bit of filler
Yep.
and a little bit of a lift, thread lift, if you can do less of two, you're going to have a more natural result.
Beautiful results.
Yeah.
Really.
So
Really, it really, really does. It changes the whole playing
Mm-hmm.
field of what we can do non-surgically now. And this is where, I think that, plastic surgeons are starting to speak out against threads a little bit. That is an issue that I'm starting to hear. Ultimately, if you go back and you really do research, threads have been around for
Long
over a
time.
decade. I have one clinic that's dedicated to all Asians. And when I started way back when in the Asian community, they already were talking about threads that are and if you understand the Asian community, it's a very trendy community, like literally with aesthetics and medicine that has to do with beauty. It's like it's like 2 months, it's a new trend. I just sit back now and I wait and I see if that trend really lasts for a longer time period, because a lot of those trends are very, very fast. For threads to continually still be there is something to be talked about with threads. The plastic surgeons in Korea, who are amazing at plastic surgery, actually do a combination of threads, or people who are not ready for plastic surgery, they're doing threads on those patients, and it does not affect whatsoever. I think the people say that it causes scarring and stuff like that. It's collagen stimulation. It's like putting Sculptra into a patient or hyperdiluted radius into a patient. So I think there's a battle that will ensue, unfortunately, as when we first got started. I'm family medicine by trade, and nurse practitioners and nurses and PAs. There was a lot of battle between the core physicians and the extension physicians. And so, I think it's melded now. Everyone's kind of gotten to a little bit more of a peaceful
kind of,
realm.
sort of, maybe not. Just saying.
Maybe not.
I won't mention any names.
But ultimately, I think everybody who really, really wants to get into this field really has to take everything into account and really, really study everything for your own selves. You can don't make any judgment calls until you yourself have tried it and played with it. I think a lot of people, where I respect them, is if you've played with it and we balance and we banter back and forth, there is a conversation to be had that you actually understand it. To me, some of the plastic surgeons out there have never done a thread lift. They may see bad work, which you see bad filler work all day long. Mm-hmm. You see bad toxin work all day long. There is bad thread lift work out there. And so if you are talking about it, you just need to make sure that you're being honest and truthful and really, really have given it a chance to do what it can do.
Yeah. And they absorb, which is good. We don't have the problems that we had years back when they didn't absorb. This is another wonderful aging process. I said that. Wasn't that politically correct? David, if you're watching.
She wants a date.
Right. He's aged beautifully. So you look at a young Beckham and a
you know what? I actually think he looks way better.
He looks way better.
Like when he was younger, that baby fat almost like takes away from him being so handsome as he is now. He's gotten way more handsome. It's like George Clooney. It's like,
right?
Oh my God, we were looking at them and we were putting these PowerPoints together. It was like, you looked at George Clooney when he was super young.
With the dark hair that was long. It's like, oh, George, no.
When you look at him now, like, it's definitely,
okay.
I give credit where credit is due.
So another one, aging. I don't know if he's done anything or not, but just aging gracefully. Not over. Hasn't done anything.
He's done some crazy stuff for his skin. You can definitely see in certain pictures, especially being out in the sun, soccer, blah blah. I think his skin has definitely aged. He's probably gotten a lot of resurfacing type of things that have done stuff like that. But I think filler wise, it's been done probably on him, but very minimally. That really is done. I think a beautiful work as far as aging. Keep some of those, those characteristics that give you that, I don't know, how do you put it together?
This is my pet peeve. You just got onto it. When we treat our patients, we need to respect their own subtle nuances. I swear this is like my theme in my head. I see so many cookie cutter people out there. I see so many people wanting to do the jaw, the cheek, the chin. Everybody looks like Kim Kardashian. We need to be careful that we don't take away somebody's own God-given subtle nuances, and we need to respect maybe their little asymmetries or their little dimples, or respect what that person comes with. If they've got a heavy eyelid, sometimes they need to kind of stay with that heavy eyelid because that's them. Yeah. And we'll show you later how it can really mess them up when they change that.
Yes.
When you don't have a provider that's respecting someone's own anatomy. Yeah. And that's something that I feel very, very strongly about. So look at your patients, look at their anatomy, look at what they have innately.
It is hard, I think, because a lot of people, we pick at ourselves all day long. Yeah. And, in life, we always want what we don't have. Until you have it, and you don't want it. I want a chin, I want a jaw.
And our patients come into us and ask for things like that. They see things on social media, and it's up to us. There's two people at fault if somebody looks funky: the provider and the patient. The patient asks for it, but the provider needs to go, no, you know what, and here's why I won't do this. We had a young girl come in here today, want her lips. She said, I want my top lip bigger. I want my top lip bigger. I want it bigger than my bottom. And I had to go in there and explain to her, look, in your ethnicity and your skin tone, that's not going to work. Mm-hmm. You're going to look funky. It won't look good. And once she understood the bottom needs to be a little bigger than the top, and she's like, oh, okay, I get it. Yeah. But patients sometimes don't understand.
No, I mean, you always look at another person, and that person, unfortunately, may have different bone structure, different facial shape. They have different balance in their face, different ethnicity that they're saying, oh, I want those lips. I want those cheeks. And it's like, you don't have that facial structure that will work for that. Let's try and get you something that will enhance your features, but not totally change who you are in that sense. So that is, to me, I think that is the biggest and hardest thing to teach in this industry. Because the science of these fillers, it's easy. A technique is somewhat easy to teach. There are many techniques. I will. The techniques are there, and it's not that you can't learn them. The hardest thing I think to learn is the artistry of this. Yes, it really is. How to keep it subtle, but also not subtle. They want a change, but they don't want a huge change. They just want that clock turn back some. Right. And so that, to me, that artistry of how you go about doing that and creating that is the key. What changes and makes you a good injector to an expert trainer injector. Because that, having that keen eye of how to do that, it's something that it requires experience, and it requires you to constantly challenge yourself. This is not about, okay, I learned from that person and I'm just doing their technique and injecting it. It's not. It's taking their technique and melding it with your artistry and what you want to create and understand for your patients. Because this, I say this at a lot of my trainings. I think what I tell a lot of practitioners to do is sit at a busy cafe, put on your glasses, a dark pair, and stare at people. I used to get called out for staring at things, and I don't know why. It's been something that I've done all my life. Yeah. But you just stare at people for some reason, and ultimately it is to figure out what looks good about them, what doesn't look as attractive on them. It's about that balance, I think, in that sense.
You guys, we chat a lot. I'm sorry. We chat a lot. We have some more photos to show you. This is just gorgeous. Beautiful. Oh my gosh. We wanted to show you somebody that's just amazing. So, obviously she's had some work done, but just beautiful. J-Lo's just gorgeous. Her nose.
I think the little fullness into this area, she's kept a little bit of that. But done very, very naturally. Bit of chin,
but very, her innate anatomy has been respected.
Yes.
Her innate subtle nuances of J-Lo have been respected. Whoever she's going to, call me. But no, I love that. I love that. Here's another one. Jennifer Aniston. Yep. She has, whatever she's kind of doing. She's done little things here and there.
Chin,
yeah, chin, nose,
nose for sure.
Again, she's subtle, and she still looks like Jennifer Aniston.
Yep.
Just beautiful.
Yep.
Just beautiful. Then we go on to this family.
The family.
Everybody wants to look like this family.
You have to give them credit for changing our aesthetic industry.
Here's the winner.
Definitely.
Here's our winner.
Definitely big changes.
Not too bad.
No.
Yeah, not too bad.
The feminization surgeries did a nice job.
But so these are all the changes that the Kardashians have gone through. And, mom looks awesome. She looks great. So they look really, really good.
Yeah.
Kylie, holy cow, amazing.
Yep.
But then here we have Khloe. This is a little while ago, okay?
Yes.
So Khloe's a little while ago. I'm going to show you. You ready? Stare at Khloe, you guys. Here's Khloe now. What the heck?
I don't know what she did. If you guys can tell me what she did, that would be amazing.
Like...
It's kind of like they took out a little bit more buccal fat, maybe did a little facelift in that aspect of it. Softened her chin a little bit more. Her lips look better. Definitely look better. The nose, definitely. Nose job for that aspect of it.
Brow shape.
Brow shape.
Wow.
For sure.
Wow. She doesn't even look like Khloe.
Yeah.
Right?
It's a very different person.
She looks beautiful. But would you recognize her as Khloe on the street? No.
Yeah.
So she's changed so much. If we go back, she's changed so much from here.
This is Khloe.
That's Khloe. Now she's lost all of what Khloe was. Maybe she wanted to, but she's lost that part of it.
Who knows?
Yeah.
Who knows? It's interesting. It looks good, but it also is, who is she trying to become?
Right.
Because ultimately we all want to hopefully be ourselves. It's interesting to see what that change is. Oh, these are
now
ones
we have a few. Now we have a few that are not so good. So we've got Barry Manilow.
Way over injected.
How come Whoville comes to my mind? Remember Grinch?
Yes.
Oh my gosh, that's terrible, huh? Usually you're the one that says the bad stuff. But
not that bad.
Look at this little lip. Oh, poor guy. So it just, just too much in that forward cheek. Too much in that anterior cheek. Ray Liotta almost doesn't even look like himself. I think his last commercial, he was so frozen he couldn't talk.
Yeah, I don't know.
Yeah. And then we have some others that were not real good. Now, you were talking about respecting somebody's subtle nuances.
Mm-hmm.
These two had procedures done that took away their innate trademark of what made them them. And that was the upper bluff. Look at Renee Zellweger.
Yeah.
Doesn't even look like her.
It doesn't.
And then Kenny Rogers.
That really, really just did away with her eyes. Her eyes told the story and really, really sold the story. And now they're honestly just like hollow. I don't know if they just took fat out, which is what it looks like. They literally took that fat out. Maybe she complained about having the heaviness in the medial portion of it, but it totally changes who she is. I mean, that is not...
she's still pretty. She's still beautiful, but it changed her look.
Yeah.
Her look.
And
then with Kenny Rogers, granted, he's got upper eyelid heaviness. He does. He qualifies, it's on his eyelashes. He qualifies for medical payment to do a bleph. Well, you don't do a bleph like that.
Yeah.
Because he just lost every bit of his look.
Yeah.
And don't we all refer to like the Kenny Rogers look? Don't do a bleph like Kenny Rogers. I think we all refer to that. So that was too bad. That was too bad that happened. But those were just some of the photos that we kind of wanted to show you of how it's important to respect somebody's subtle nuances.
It is.
We did want to talk quickly about rheology.
Yeah.
So rheology, some of you did answer the questionnaire earlier, what is rheology?
Mm-hmm.
A lot of you knew what rheology was, but a lot of you didn't know what rheology was. And you might not be doing aesthetics. You might have just gotten into aesthetics. Hopefully you haven't done aesthetics for 10 years and you've never heard the word rheology, but we're going to help you out right now. Rheology is what our products are made of. It is what the what's in the syringe, what's in that filler of Radiesse, Juvederm, Restylane, Belotero, what's in that syringe. It's how much hyaluronic it contains. It's what the G prime is, or the lifting capability of it is. It's what the elasticity is. It's the particle size, the molecular size. So when Dr. Kwok is talking about putting a firmer product in to give more lift, we're talking about a higher G prime, or a product that will be on the higher G prime scale. Yeah. Softer products can go more superficially.
Yep. Your higher G primes are going to be probably your Radiesse, which is the strongest G prime out there. Be more careful because it's not a hyaluronic acid. Then you have your Restylane Lift, your Restylane on that scale. I think as you come down the scale, probably the middle range is G prime. True G prime is more Volumas and Defines and stuff like that. Those are in the middle range. And then your super, super light G primes are going to be, you get down to your Volbellas, your Beloteros, your Restylane Refines and stuff like that. So everything else is kind of in between all of that, in a sense. And so you have to kind of, it's like playing a little kind of chessboard in a sense, or, you have to figure out, what are you trying to do? Are you trying to lift? Are you trying to contour? Where are you trying to place this product? Because then each product plays a little bit differently, based off of the characteristic. So rheology is kind of, you could say, it's like the characteristic of your product. And, I personally don't like it when a person or a practitioner goes, oh, I just use it just because it fluffs, or just because I was told to use it there. That's an incorrect answer when you're trying to explain to a patient why you're choosing that product. You don't just use a product just because your company orders that product. You still want to do a little bit of research and understand why that product that you're using is a good product for the area, versus other products on the marketplace. As we come along in this field, you will start to see more and more and more fillers come onto the marketplace. There will be more and more. And if you don't understand rheology, you will get lost and sidetracked from it. And honestly, I try not to stick with just one company. There is one company that I like the products more so, but I will use all the products from all different ones. I will always try out new ones and see how it is. I base it off of longevity. I base it off of how the patient feels with the product in there, what kind of mobility that it has. There's a lot of little things that I think of when I'm trying to choose a product to bring into the clinic. So I'm always open to more products out there, because I think, like with threads, there's so many different companies. There are going to be certain ones that I like from different companies that make my toolbox work for me and my artistry. This is the way it is. You're going to have different makeup brands that you guys use because you like that makeup for this area, your eyeshadow, that makeup for your blush, that makeup for your lipsticks. So there are different brands for a reason, and you have to figure out what it is about those products and those characteristics of those products that make it work for you and your artistry.
Yeah, I always say you have to know the rheology of your products. You have to know why you're choosing what you're choosing for the area that you're putting it in. You can't just use every product to put everywhere. That tells me you don't know anything about, or I've had providers tell me that, like, I like this one product and I put it everywhere. It looks great. It tells me you don't know anything about the rheology or what that product's made up of. So you need to look at the patient, and you need to choose your product according to what your patient needs. Their skin thickness, you need to pick it according to how much sub-Q tissue they have, the depth you need to put it at, how much lifting do I need, how much contouring do I need. Right. So you pick your product according to your patient, not according to who gives it to you for a lesser amount, not according, you pick it according to your patient. So always let that be your guide. So you have to know rheology and how that product interacts in tissue, what it does, how it moves, how it integrates before you do anything, before you pick it.
I mean, there's a balance. I mean, I think business does come into play, because we all do this because we all want to make some money. And so there is a balance of business and choosing products. I will always look at that as a concern. I mean, that's, every one of us needs to balance that the business aspect of it with the the products that are out there on the marketplace. And so you got to choose wisely. I think for the most part, most products range within a certain range. Don't discount your education and your service based off of that aspect of it. Keep your prices at a reasonable price for your time, your expertise, you taking the time to spend learning and educating yourself or going to conferences and things like that. Don't undermine yourself and get into a bidding war with the next person. Get your artistry, get your techniques up to par, and your work will speak for itself. And you know,
what a good point. What a good point you just made. As far as people discounting products, I think that when you discount a syringe of filler, you know, we're going to do a special on Juvederm, a special on Restylane, a special on Radiesse. When you discount that syringe, you're discounting your expertise. So I want you to keep that in mind. And I always say that a syringe is like a paintbrush. It can be in the hand of a toddler or it can be in the hand of Picasso. And everybody sells paintbrushes, right? It depends on whose hand it's in. So your front office needs to help explain that to people who are calling and let them know that they have somebody that's trained and that's educated and really is an expert at what they're doing. And that's who is holding that syringe. That's very, very important. Many patients don't know to ask for that.
Yeah. It's a hard balance. I mean, I personally do discounts when I'm doing multiple syringes. I think the first syringe, I think I charge more regular prices, but as they're doing more, I mean, budgets are limited. Yeah. Not everybody has thousands and thousands and thousands of dollars to do this type of stuff. I mean, I just got injected in my jawline last week because it started to disappear. But anyways, we injected 10 syringes in through this area. And if you charge regular price for it, it would have been tens of thousands of dollars or thousands of dollars. So, you know, you have to balance it out. I think that I take that into consideration, and, you know, you figure out your time that it's worth, and, you know, you adjust that accordingly in that sense. So I'm not saying that you have to charge every single filler at a regular price. I think when you're doing it and understanding what you're trying to achieve for your patients, you know, there is a balance and understanding of what you can achieve with it, because ultimately you don't want to do one syringe because they're one or two syringes just because their patient's budget is only this amount. If you can kind of manipulate it and you can get them to get a certain amount because this is what their budget is, you always want them to walk out with a wow factor. Yeah. To me, I use the analogy, like I go to nice dinners. If you go to a nice dinner and you pay $100, and it was okay, it was, you know, service was okay, this is $100, you would kind of contemplate, would I do it again? Would I go back? But, you know, there are some dinners that $200, $300 for a dinner per person, but the service was amazing, the food was amazing, the whole experience was amazing. Most of us would go, you know what, I would do that again. I would spend the money to do that again. So you have to take in consideration when you are doing fillers. Don't just do one filler if a patient really does require 2 or 3 fillers. You know, if it really takes 2 to 3 fillers to achieve at least some change for them, make sure you do that 2 to 3, or tell them to save it and, you know, save their budget and let's do it when you really can do it. It's a hard balance, you know, because you have to take consideration of budgets and all of these things. So you guys are in a hard place. It's understandable, and only experience in doing it and really explaining to your patients what you're trying to achieve for them, get them on the same page as what your vision is for them.
Yeah, I absolutely agree. If somebody wants less syringes than what I recommend, I generally will tell them to wait and save, because I don't want them to be disappointed and go away and be disappointed. We're going to take some of your questions. Yes, we talked too much, you guys. Sorry. We're going to take some of your questions and answers now, or questions. We had a question: when doing filler and threads, do you do deep filler first, then a thread lift at a later appointment? That's a really good question. Good. To do fillers first or the thread lift first? What do you like to do?
I personally, so when I'm talking to the patient, one of the things with threads that you want to do is I actually will lay them back and I'll give them a mirror and let them see themselves with their skin laid back. And when it's laid back, that it kind of gives you an imagination of what your of how the tissue will lay into the onto the face. And what you can actually see is indentations or areas that they are lacking supportive volume. And I will point out, this is an area we're probably going to need filler. No matter how much lifting I do, I'm lifting only tissue. There's volume loss into these areas. So once we've had that conversation, I will tell my patients, you can do the filler first, and then we'll lift over it, and we'll do that on separate times. If they really are, nope, I want to do it all on one day, and I have patients who come from different states or different countries, and they can't stay here for that long to do multiple sessions, we can do it on the same day. If I were to do that, it's a hard choice, and it takes kind of an experience type of a thing. In general, for certain areas that I know the threads may not make a difference in those areas, I probably would inject the filler either before or after. I don't think it matters. If it's an area where I know the thread potentially may lift this heavy tissue and lift it back up in place, I would probably do the threads first. And then after finishing their threads and seeing how it plays, then I would go down and actually inject them deeper with a filler right afterwards. So you can do it right after that.
Yeah, I agree. I think either way is okay. Yep. I think either way is okay. But many times we'll take the threads and we'll be able to pull, a certain vector up, and it moves the fat right back up into the mid face, where you're like, whoa, I really don't need to do that filler anymore. Yeah. So today I had a patient who's going to be doing threads, and when we kind of played with the vectors, I could tell that she's still going to need some filler. Yeah. So you can do it either way, but just make sure the patient's well educated.
Education. Yeah. Education is the key to it. And we had a question on how to address some of the common injection complications. It really is expectations. Lip filler, you're going to bruise, you're going to swell. If you don't talk to the patient ahead of time, my conversation while I'm finishing up and cleaning up the room and doing it is, I will tell the patients, lips are going to look swollen for the next day or 2 days. You're either going to strip or you're going to hide.
You either hide or you're going to be dancing for dollars. That's what
so those are the two things, because and then it's the thing, it is an extreme. Most patients aren't going to get the super huge lips that are stripper lips, but most patients will get some form of swelling that may freak them out, especially your first time patients. But I tell them this is going to be the biggest it is for the first couple of days. And if it's big, remember, today is the new normal. You forget how you looked like yesterday already. And I tell them for sure that first couple of days, if you end up liking it, especially that first week, in 2 to 3 weeks, you're going to come back and tell me, I need more, I want more, or your fillers disappeared. If you do not have that conversation with your patients, you will for sure, pretty much have patients come back and say, I don't see a change. Your filler didn't last very long and stuff like that. So this is about, gaining confidence. We had a question about that. Gaining confidence, but it's really about experience. If you have these experiences with these patients and now you're able to manage those expectations ahead of time, your patients will go, oh, and when they come back and follow up with you in a month, they'll be like, you know what, you were right. I liked it when it was more swollen. Yeah. And I'm ready to do my next syringe. When should I do that?
And they're not. So I always like to under promise and over deliver. So I always kind of tell people they're going to be really, really swollen. And if they're not, awesome. They come back, they're even happier. I tell them they're going to bruise. And if they don't, they come back, they're even happier. Yeah. So under promise and over deliver. Yep. How do you gain confidence being an injector? Time on tissue.
Yep.
Mic drop.
That's
it. That's it.
It really is.
10,000 really hours. That's it.
It really is. Just get in there. Don't be afraid. The more you think about it, more you trip yourself up. You learn about the safety. You learn what is, aspirations, blah, 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 what to watch out for and things like that. And so I think if you understand, you're not going to kill a patient in this field. For the most part, you're not going to kill a patient. Yeah. There are certain areas injecting wise that you really, really want to maybe avoid unless you get super, super advanced and really willing to take that risk on yourself. That the blindness is probably the worst type of case scenarios in a sense. So ultimately, a lot of this is you getting time on tissue, getting that experience, seeing your mistakes. Don't be afraid of making mistakes. Mm-hmm. You don't want to make outrageous mistakes, but being able to see what mistakes you make and how you're going to correct that, and realizing and sitting down and say, okay, I made this mistake. What could I have done better? Bounce off ideas off of people that your peers out there and say, hey, what happened in this case? What could I have done better? Always analyzing and see how you can do things better. I'm constantly changing my injection technique based off of my different interactions with my patients, and the way the filler plays in that patient, the way that it lays, the way that it responds. Every patient is going to be different, and as you gain more experience and time on tissue, you'll see more of a pattern.
And one thing I want to say, you'll never be 100% confident. Never. 15 years, 13 years, am I 1,000% sure, exactly confident this is going to exactly look this way in this patient? No. So everybody's tissue interacts differently. So just know you're never 1,000% confident about what you do, right. But be careful, be conservative. It's always easier to add than it is to take away. Right. So make sure that you're a little bit more careful, I would say, and little by little, every time you inject somebody, you're going to gain more confidence. Yep. We had a question about lip migration and filler. This is a hot topic right now.
Yeah, it definitely is.
So is it the filler or is it the technique? I happen to, God, this is such a hard question. Historically, most of the lip fillers have been done with Juvederm, mostly, like through the years. It was Restylane, and then kind of Juvederm got, into good graces because it fluffs up later because it's got so much hyaluronic acid in it that it absorbs water and fluffs later. People love the big lips. So a lot of people had Juvederm in their lips. Are we dissolving a ton of Juvederm now? Yeah. Is it the filler or is it the technique? So I think historically, and I still see on Instagram, and I want to do this, but I still see injectors injecting like really deep into the lip under the muscle. Mm-hmm. This fat pad is one confluent fat pad from the vermilion body up here. So when we inject below the muscle, in the muscle or below the muscle, and you've got so much contractility in the lip, is it pushing it up and helping it to migrate to the upper lip? Mm-hmm. Is it the filler and the rheology of the filler, or is it the technique because it's put too deeply and it's being constantly pushed up by mechanical motion?
I would say definitely technique outweighs it, but technique plus the filler choice definitely adds to it. I would definitely agree on that, but I think technique probably is the most. I think most people unfortunately keep wanting more and more and more. Because I think a lot of the migration happens, as you said, when they inject a little bit deeper, and people are looking for bigger, fuller lips. And they're not necessarily looking for the bigger, fuller lips. They're looking for more of an outturn as we start to play around with different techniques. When you start to do more of these flipping out, like Julie Horn's fencing techniques or Von Eyck kind of tenting in a sense, I think as you learn to do those techniques and you're able to flip the lip out naturally, patients aren't so much concerned with adding volume. I think most people, unfortunately, I would say that it's more technique driven that migration happens because they liked it when it was swollen because it flipped them open more. So they get this in the mind that they want it to look like that. And so when you go back in and they're doing the same technique, they keep injecting behind. And so it ends up migrating up and up and up because the lips have only so much room to give. At the end of the day, if you're doing 2 syringes at one time, I think that's way overboard, but that's my opinion. I think 1 syringe at a time is perfect. You give it time to settle in and you do all those things. But ultimately, I think it is more technique over product. But I definitely think the Juvederm product is much more cohesive. It's much more fuller. I think you definitely, in my experience, found that I get a lot more little lumps and bumps from Juvederm than some of the other newer products that I've been using on the marketplace. So I definitely give some of the credit to the product choice. I don't think with that product I can do as much of the nicer lip flipping because it is much more of a fullness rather than actually much more softer in that sense. So ultimately, filler in the brand that I prefer currently, I really do like Kiss. I think it really, really is that nice balance. I think the Galderma has made a great product. It's really forgiving. Just like the refines and defines, so it's all within that same expression technology. It really, really integrates really, really well. Like you can inject it, and you really, if you just mold it just a tiny little bit as it softens up in the tissue, and you just mold it, it kind of blends into it. I think
like
there
butter.
was one patient that I didn't mold as well, and so she came back and said, "Do you see these little?" And it was the fencing technique. Do you see these little tiny bumps in here? And I literally just massaged it a little bit more, and it blended out very, very nicely. She said, "Oh, okay." So I think definitely product choice is very, very important. I think there's something about the expression technology that really softens it and does a really, really nice job in that sense.
And that question regarding what's our favorite filler, it's tough because we pick the filler according to the patient. So what do we love most for like say zygoma and mid face? I use lift. Chin, I use lift.
Well, lift for most part for my males, or really that person who are fuller patients that really need that angularity. I actually really like radius in the cheeks.
Okay.
I really, really think it plays really well. Males, it really gives them that structure that you're talking about. It really gives them that structure. So I like radius and I like lift. I think, as you said, it really just depends on what you're seeing, your experience with the different products. But those are the probably, and I really think lift is taught incorrectly to be injected. That is my big thing. I think people don't see the power of lift because they're always doing this perpendicular injection, which is what's taught 99% of the time. It's taught to do this injection, and if you realize the rheology and the particulate nature of it, it is taught completely incorrect on how to use it and how to inject with it. That's why I think Define and Voluma are much more forgiving because it's a gel product and you can get away with doing these depots because it kind of melds back together. It doesn't really do a lifting job. It just kind of pulls in water, so you get this fluffiness. So I think if you're really, really starting to get into the artistry and the techniques and stuff like that, Restylane Lift needs to be injected completely differently than the other types of fillers.
Yeah, it's got a high G prime and big particle. If you were to ask me what one product I could take with me to a deserted island, it would be Define.
Mine would be Lift.
Yours would be Lift. I know, because you love Lift too. I love Lift too, but I can put Define anywhere and it looks good. With Lift, it's a higher G prime. So if I have somebody with a really,
I can put it anywhere.
If I have somebody with a really, really skinny face and no fat, I don't like to put a high G prime under there. But I find that Define is one of my absolute favorites too.
What about the longevity in the lips?
With Juvederm or Restylane?
So longevity is the biggest farce out there. It is the biggest farce out there. There is no such thing as longevity in my book, because everything with all of these things is about patient expectation. If you really think about it, when does your patient really, really come back in? It's when they feel as though their lips are small. They don't come back in. If they come back in once a year and you look at them, you're just like, okay, I really don't think you really need it.
Looks fine.
You look fine. So longevity is a case that unfortunately I think the companies sell to you guys on what it is. All the white papers out there with any of these fillers, read them. None of them have actually done biopsies and really, really shown when these products actually break down. Okay? None of them. All of them have shown is independent physician looking at it, the patient themselves looking at it at 6 months, 9 months, 12 months, 18 months, whatever it is that you want to float your boat, and they say, okay, I think it's not there as much. It's gone down, grade 1, grade 2, whatever that scale is that you're using. But there's a physician down in Australia that started to do MRI, CT scans on these fillers. These fillers are lasting 7-8 years into the area. And I've known this because Restylane, 6 months, I've injected it underneath the tear troughs or in lips. 5 years later, it's still there. So there is something, and I like Lori's theory, potentially, that there are some hyaluronidases that we naturally produce in our skin that maybe you break it down more. Faster for some people versus other people.
So Dr. Cotofana, if you're listening, because your DM person blew me off.
I know. She got a really bad
I want a research
off.
Article on innate hyaluronidase and hyaluronic acid filler longevity.
So, I mean, that honestly is the whole longevity thing is a farce. I think fillers all last. People forget they age. Every year you age, there's documentation that you're losing 3 to 5 syringes of volume per year of life. Remember, you're globally aging. So you really should be globally addressing the whole face in a sense. And so longevity really is a determinant of expectation of your patient. I tell patients, it's kind of like your gray hairs. When does it bother you? Is it a millimeter and you're back into your hairstylist, go, help me, my hair is turning all gray? Or are you waiting until there's like 5 inches before you actually address it? So longevity is the wrong thing to be talking about with patients. Really, it is about expectation.
But I do think that fillers last different amounts of time in different individuals.
Yes, exactly.
So
it does. But
I think it bothers people at different rates.
You can't tell. I think there's a general sense when I try out products. So I know we've had some questions about Versa. I tried it out a couple years ago when it first came out. I've tried it actually recently, and we placed it kind of all over. The problem when I had it for Versa is it actually doesn't last very long.
I'm just starting to try it a little bit now, so we'll see.
Kind of slowly disappeared on and we did it on staff, so I could really see it. And we played on lips, we played on cheeks, we played on under eyes. They gave me enough syringes to play with. And my staff actually was very happy for the first couple months. They were very happy. Like, oh yeah, it looks great, blah, blah, blah. And I was like, okay, perfect. I'm going to be joining the Versa train and really starting to it. And unfortunately, a couple months and COVID hit, and then I came back and I asked them, so how was the Versa? And they're like, oh, I got injected more into the area because it didn't last me very long. And this is unfortunately for me and my staff. I've done it 2 times on 2 different occasions. So I tried Versa probably a year or 2 years ago, and I tried it again this year, literally right before COVID, I think. And I had high hopes. I honestly really, really had high hopes because I like the idea of what it can do. And I like the fact that it is at a decently low price point. But I didn't find that, unfortunately, in my experience, I did not find that it lasted very, very long.
Interesting. Because that's pretty high. It's got a very high hyaluronic acid content, but it's pre-hydrated. So it's already pre-washed in a bath. So it doesn't swell up in the tissue.
Yeah.
Which is, I like, that's a really interesting concept.
It is like a really great
high
concept.
25%?
I used to like using their toxin way back when. They had a really good one. They really need to bring that one back.
Right? So I'm just playing with Versa a little bit now.
I'm what your experience
late
is.
On the bandwagon
and
with
you
it,
guys tell me your experience.
Yeah.
I mean, this is my experience. I chose my own staff to inject, and we injected like 5 or 6 of my staff at one time, and it was multiple. Like we tried twice.
Yeah. Okay.
And so I really wanted to buy Versa, but with that longevity on majority of my staff, I don't think any of them really figured that it lasted them that long.
I'll keep an eye.
So just experience.
Yeah, if you guys have had experience with Versa and you've used it for a while, message
us. Let me know.
Write a little question in there for us. We can't take any more questions now because we're so late. So sorry.
Talk about your lift technique. Oh, that's a hard.
Gosh. We'll do a whole show on
that. Is a hard one. That is called my lollipop technique. Don't let anybody tell you it's
trademarked.
I need to trademark it, lollipop it. But it's a little bit more of an advanced type of technique in that sense. So
we'll bring that up. We'll bring up his really cool technique that he uses at a different show. Yeah. We'll do that. Yeah. So next month, we want to tell you, we have a giveaway.
Yes, we have a giveaway.
Yeah, we have a giveaway. And one lucky winner that's watching tonight will get will win the webinar series bundle.
Oh.
And what's in it? You get continuous online access to 8 webinar courses on our digital course library, which includes lips, temples, under eyes, Sculptra, aesthetic, PTO threads, hyperdilute radius cannula, all kinds of that stuff. So it's awesome. Our approach to facial balancing webinar, and some of our safety and anatomy webinars. So you have to tag a friend on the AI post, comment what topic you'd like to see us discuss, and follow the Aesthetic Immersion, Dr. Guns and Needles, and Injection Expert. So follow all 3 of us, tag a friend, and comment like what subject you want us to discuss. Yeah. We have some great stuff lined up.
Then we're gonna
somehow they choose a winner. Somehow.
Let us know what other topics you want to talk about. If you want us to continue this topic, I think this is is a fun topic. Fillers is a fun topic. I think you can go on and on and on and on.
And
about
we do.
It.
Sorry, so sorry.
But we need to get going. Our team is going. We need to cut it short, but. August 4th, we are doing our next AI Live. It's with Mindy and
Aaron from the Aesthetic Show. It's everything about the Aesthetic Show. So it'll be kind of cool. So it'll be awesome. Yep. Yeah.
And so they'll be offering, I think, 2 free entrances to the Aesthetic Show. So that will be the giveaway next time. So follow us August 4th.
That's worth a lot of money, you guys.
Yep, that is.
So that's going to be awesome.
So tell all your friends to come and watch. And thank you very much from us here at the Aesthetic Immersion. We'll see you at our next AI Live.
Thank you so much for joining us, you guys. We'll see you August 4th.
How's everybody doing?
Either hide or you're going to be dancing with dollars.
It's really about creating a platform